Bloating after tummy tuck. I had a tummy tuck with muscle repair almost 2 years ago, and this is how I look now. Have I seen the... Anyway, I've had no replies from my surgeon, which was in Slovakia, so I cannot ask him. If I have a small dinner, I bloat out and feel like I need to be sick sometimes. But anytime I eat, I bloat even worse. I've had an ultrasound done with the NHS a few months ago to see if I had a seroma, and I don't. I would also like this surgery redone because the scars are terrible. Oh, I have seen this. Yeah, sorry. I got infected and the stitches came out too early, so I guess that's why my scars are big. I've had surgery done elsewhere and I have never had a problem with healing before. I paid for an extended tummy tuck for the reason to make my hips were flat, and now I've been left with the dog ears worse on one side, so I'd like them to be flat and just an overall better scarring, really. Woo! Blimey. What? So, okay. So first of all, you can revise the scarring of a tummy tuck, and I've seen these scars, and they are quite wide. And you could revise. That's quite a big op because you've got to cut out the whole scar and resuture the whole scar. But that's doable. That's potential. And dog ears, potential to take the dog ears. That is potential. That is potentially possible. If you went somewhere else, you'd be charged full whack, and that'd be quite expensive because it's quite. It's not as big as a tummy tuck, but it's still quite a long op, a long scar to revise. You wouldn't be able to do it under local anaesthetic because it's an extended tummy tuck, so it's a really long scar, and you'd have to have a general anaesthetic, so it's going to cost you a few £1,000s, I suspect. So again, it's always best to go back to this is why it's always best to go back to your original surgeon because they've got a vested interest to get it right because they don't want to be they want you to be happy, but it's always difficult if they're overseas. The bloating is a bit different. The bloating and feeling sick and things that is unlikely to be due to something to do with a tummy tuck. That's more intra-abdominal. When you do a tummy tuck, you're just dealing with the skin and the fat on the outside of the abdomen. You're not doing anything in your bowels, in your stomach and your bowels. That's a problem with the gastric transit, the transit of food and fluid through your bowels. So that's a different problem. So I think you should see your GP about that. I'm not sure if your surgeon will be able to help with that if you get sick. Oh, it sounds like you've had an ultrasound. That's right. You said you had an ultrasound and you've not got a seroma. That's good. But the bloating, if it's sort of bloating coming up after meals and things, that's doesn't. I don't think you need your tummy tuck redone. That bloating sounds like an intra-abdominal problem. So I don't think that's necessarily a problem from the tummy tuck. I think that might be something else going on. So I think you've done the right thing by obviously being investigated by the NHS with the ultrasound and what have you. But I'm not sure. I don't think surgery on your tummy tuck would help that. The surgery could be done for the scar and the dog ear, but not necessarily for the bloating.